name is Nakia, and the drug I was selected to teach is clozapine. Clozapine is a atypical or second generation antipsychotic. These are preferred in treating schizophrenic patients because they produce less extrapyramidal reactions and they also produce less tardive dyskinesia. Clozapine works by blocking the dopamine receptors in the central nervous system. The therapeutic effect of clozapine will be diminished schizophrenic behaviors and also diminished suicidal behaviors. Some of the side effects of clozapine will be weight gain, granulocytosis, hyperlipidemia, hyperglycemia, constipation, dizziness, sedation, hypotension, tachycardia. Okay, when a person first starts clozapine, you want to monitor their blood work, like their white blood cell count, their absolute neutrophils, and their differential count. And it's going to be monitored periodically throughout the medication therapy. When they first when they first start the medication, it'll be every week. For the first 6 months, they'll have to get their white blood cell count, absolute neutrophils, and differential count monitored. Then after the 6 months, it'll be bi-weekly. And then after the first year, it changes depending on the patient's response to the medication. And also, you want to assess their fasting glucose and their cholesterol levels when they're first starting the medication. That isn't done periodically, but that's when they're first starting the medication because it produces side effects like hyperglycemia, hyperlipidemia. Clozapine also decreases the threshold for seizures. So, if a patient has a history of seizures, you want to initiate seizure precautions with that patient. For nutrients with clozapine, there wasn't really much I can find on that, but I would know you would want to have a diet that promotes losing weight because of the weight gain. I did research and it said that weight gain and clozapine, which weight gain and second generation antipsychotics was very common, and clozapine is even more common. One of the more common second generation antipsychotics that will have weight gain. So I would teach the patient about losing weight. So maybe a healthier diet, fruit, water, and also water promote a healthier diet will promote better behavior. Well, it'll make a patient feel good because weight gain will create. I'm sorry. Weight gain will create some personal issues with the patient. Okay, it's contradicted in hypersensitivity, bone marrow suppression, severe central nervous system depression, uncontrolled epilepsy, coma, and it's also contradicted in clozapine-induced granulocytosis. In granulocytosis, that's why you want blood work done because that will help healthcare providers pinpoint that, and is the blood work is more frequent in the first year of the drug, and then after that it's periodic. It's depending on the patient. So some things that I will teach my patient if they're taking clozapine would be report like any sedation. Well, I would assess them for sedation and drowsiness. I would tell them not to operate heavy machinery if that does occur. I will also tell them to, when they're getting up, they want to slowly rise just for because it creates hypotension, so you don't want to make the blood pressure rise quickly because then they're going to fall. I will also tell them about the healthy diet. We already went over that because weight gain could create really bad body image problems. And let's see. Also a healthy diet for hyperglycemia, and you want to, if the patient does have issues with their glucose, you want to make sure they're also have that also I'll fall on their medication for that issue too, so that it won't create a bigger issue. Let's see. That would be what I'll teach my patient if they were to be taking clozapine. Thank you. Bye bye.